I'm O'Haley Chambers. I work for the Food and Drug Administration in Silver Spring, Maryland. I am an ophthalmologist. I have been with the Food and Drug Administration for the past 25 years. I'm also a clinical professor of ophthalmology and adjunct assistant professor of computer medicine with the George Washington University. The most common question I get asked is why a particular product has not been approved. And the most common answer to that question is that no one ever submitted an application for that particular product. There are a number of different reasons why companies submit applications or don't submit applications. One of the biggest gaps we have are products for endophthalmitis. We have no products approved for endophthalmitis. We have a number of different antibiotics and other anti-infectives that are used off-label, but by and large, companies don't want to take the legal risks of introducing a product for something which frequently has a bad outcome regardless of what you do. We have other areas where companies have just decided it's not economically worth studying a particular product, and so they don't go and study the product, they don't submit an application, and then we can't approve it. Occasionally we get other applications where the benefits don't outweigh the risks, or the product is not stable over the shelf life, or there are some other aspects that are problematic within the manufacturing. But by and large, the most common reason is people haven't decided to try and study it for a particular indication. There are a number of indications we continue to try and support. We try and push people to study areas like dry AMD. We wish we had a medication to be able to go and treat. We don't frequently just want one, we want multiple. We want to be able to give patients and physicians choices. There are a number of old drugs that have been marketed for a very long time for which people have never submitted applications. Some of the more common products are things like phenylephrine or fluorescein strips. Those products have been marketed for a number of years, have never submitted an application. And while we have strongly encouraged people to submit applications, so far that has not happened. And we'll continue to go and encourage them. We have tried to provide incentives for companies to submit applications by saying, if you are the first ones to get approved, we will then start going after all of your competitors. And so that you could essentially make it economically worth your while to go and submit an application. But to date, that hasn't happened with some of the products. It has with others. Frequently, the new drug approval process is construed, described, made out to be a very onerous process. And I wouldn't begin to say that it is a very simple process, but the goal is to have safe and efficacious products out. It does no one any good to turn down products that are safe and efficacious. So we try and help companies that have good products get on the market, stay on the market, have reliable products that do what they say they do.